this first question has a little bit of a story around it, so I'll just read that and then get into the question. My father is now in a care facility with dementia, and we have an advanced care plan, which was developed with my dad in his early diagnosis. Advanced care planning is something we feel quite passionate about since my mom died 16 years ago and spent her final week unconscious in the ICU. My dad is now in moderate advanced stages of dementia, so ICU is something we are keen to avoid if possible. My concern is around emergency treatment for a potential fall and, say, a broken hip. My dad has requested no life-prolonging treatment or medical procedures, and that all life-prolonging treatments be stopped and he receive palliative care. It is often hard to stop the medical process once a patient is admitted into the hospital system. Do you have any advice around emergency treatment, how to deal with medical emergencies, and how to handle this when filing or filling out an advanced directive care plan?
Great questions. And thank you for your advocacy implied in this question. So it sounds like you guys have learned a lot from your situation with your mom and want to do a little different with your situation with your dad. So amen, right on. So now to your question. So if dad, for some reason, ends up in the ER, like falls and breaks a hip, right? So he's in a care home, I'm assuming on the frailer side, and breaking a hip happens pretty dang frequently. And so that's a situation where you find yourself pretty quickly to the ER because just the pain alone is going to need to be addressed and imaging to figure out what's happened, et cetera. So making sure that the care facility, requesting the care facility be sure to send a copy of an advanced directive with the admission paperwork, with the transfer paperwork. You yourself as a family member bringing that advanced directive if you have a copy, or representing it faithfully to the doctor. A lot of doctors aren't going to need to see the paperwork. If you are clearly the next of kin or clearly the family member who's trusted by the patient, oftentimes they won't going to need to see all this paperwork, but still bring it with you if you have it. That will help. And then in that situation, you might enter the ER, let's say they get a x-ray or whatever else, and it shows a fracture of the hip, and then it's a question of, well, surgery or not surgery, not to prolong his life, but surgery for comfort or the ability to walk again. This comes up not infrequently. Of course, surgeries will still have their risks, but it's not conceived to, this would be a surgery potentially to help his quality of life, and therefore might qualify under his previous stated wishes and your wishes as a family. That's something you want to pursue. So in that case, when a sort of unplanned but important surgery crops up, sometimes the surgeon will ask you to revoke the old advanced directive, agree to a full code for the procedure itself, and then once through the procedure itself, so if something happens on the operating table or whatever else, that they can resuscitate them in real time during the surgery, or correct what's going on with the anesthesia or whatever else. So sometimes I'll ask you to revoke your DNR, agree to a full code just for the surgery, and then once after the surgery, you can make sure to follow up and make sure to go back to DNR. If the surgeon, you can talk that out. You might say to the surgeon, hey, if dad, if his time comes during the surgery, that's okay. That's still with his wishes. That's him. We should allow that death to happen. He still would not want to be resuscitated, even when pursuing a procedure for quality of life like this kind of surgery. The tricky here is the surgeon may or may not agree to that. Many surgeons won't, for all sorts of reasons, including they don't want people dying on their operating table. It can come down to that for their mortality risk, their own, doctors get graded on intraoperative mortality. So that may sound like a pretty lame reason to do anything, but it's a real reason for the surgeon and others. So it gets hard. If that surgeon's unwilling and you really feel strongly about it, you might say, is there another surgeon in your practice who might feel comfortable doing this? But eventually you may be pushed to, so either if you want the surgery, we got to revoke the DNR, just make sure that right after the surgery, you get the DNR reinstated. And that's a communication moment. And then was that everything to the question, Sonia? Was there more to it?
I think so. Let's see. I think understanding how to mitigate, types of care that aren't wanted when coming up against a medical emergency.
Yeah. Well, so that I sort of drilled down on a specific thing like a hip fracture, which is so common. So, but there other things may come up that don't require surgery, but that gets the whole medical apparatus all wound up, or the nursing home wants to send dad back to the hospital, or whatever's going on. So the extra layer of support, the extra thing you as a family can do around protecting dad's wishes here would be to add a pulse to the mix. And in advance of the emergency and during an emergency, it's not a time to fill out a pulse. It's just not really feasible. Excuse me, feasible. So adding a pulse to the mix, adding that doctor's signature to a form, and being very clear about this, that will help protect your dad, much more legally binding than an advance directive. So even if he makes his way to an ER or whatever else, if that pulse travels with him, and especially if your dad is seen consistently in the same health system, that's the ER he might go to, make sure that health system, his other doctors, have that pulse form, have that advance directive, and that it's uploaded into their health system, that it's documented in their computer system and therefore accessible. That will help protect things, because then in ER, no matter what's going on, it'll come up in your dad's chart if it's his local hospital. So otherwise, if it's not a local hospital or whatever else, make sure to make that pulse goes with him on the gurney to the hospital. And also, you can also talk to the facility and say, hey, no matter what happens here, guys, we do not want to go back to the hospital. If there's an emergency, we want to immediately enroll in hospice and help him die comfortably, for example. So that can be meted out in a conversation with the facility in advance of an emergency. But during an emergency, there's really not much time to do that. So then last point here, guys, is you can, irrespective of whatever health system dad's in or anybody's in, you can upload your advance directive and pulse form to these third-party registries. mydirectives.com is an example. But there are these third-party cloud-based secure places you can upload your wishes, and then they're accessible from anywhere. So then you just have to tell the ER where dad lands to go to this website and download his advance directive. Okay, long answer, but complicated question. I hope there's something in there for you.